Thank you, everyone. Welcome to Friday afternoon, April 24th, the City County press conference on the status of our community. On behalf of Mayor Artis, Chairman Zimmerman from Tazewell, and Chairman Krug, who I talked to this morning from Woodford County, welcome. We appreciate everyone tuning in to stay attuned to the messages and the information and fresh facts as they continue to come out. We've got some really important folks to speak with you today. I know two of my cohorts in public safety are here, but Lori C. as well from the Central Illinois Agency on Aging, and Dr. Bender from UnityPoint Behavioral Health are also here today with the Sheriff of Peoria County and the Police Chief Marion. I know the news this week has been mixed in the sense that some parts of our country are seeing a slowdown in COVID infections being reported. Some parts of the country are still seeing an acceleration. I know here in Illinois there's some question as to whether we're peaking or not quite peaked. This week's data looks kind of mixed. But the probably most important fact of the week is the governor has chosen to protect the health and safety of the citizens of this state by extending yet one more month the shelter order. And that is certainly coming with plenty of mixed reaction. And when I say mixed, that's a polite word for saying a lot of dissatisfaction. And while none of us want to have to make decisions like that, at the local level here in Central Illinois, we have to abide by them and work our best to manage our lives in spite of them in some cases. I'm going to invite Monica Hendrickson up to give you the latest statistics, and I certainly encourage all of us to take a deep breath on the latest news of an additional month of shelter. And please do your level best to follow the rules as they're published. And I'm sure our law enforcement experts will be here to explain some of that in just a few minutes. Thank you, everyone. Monica, welcome.
Thank you, Chairman Rand. Good afternoon. We begin today's briefing for the to-date totals as of Friday, April 24th. Today marks another milestone in the Tri-County. We are now reporting over 100 cases in the Tri-County, 101 to be exact. Peoria County is reporting 57 cases, Tazewell County reporting 33, and Woodford County reporting 11. The total number of deaths to date remains the same. The hospital systems of OSF, UnityPoint Health report 17 ICU beds in use, 10 for individuals confirmed with COVID-19, and 7 for persons under investigation. In addition, they're reporting 28 non-ICU beds in use for individuals either confirmed or under investigation for COVID-19. For Peoria County specifically, of the 57 confirmed cases, 32 have recovered, 14 are at home and self-isolating, and 9 are currently hospitalized. In regards to demographics, 60% are female, with 40% reporting male. Majority of our cases are still between that 50 to 69 and 30 to 39 age range, and 54% are white and 39% are black. Of the 5 new cases reported in the Tri-County, 3 were identified through the Heartland Health Service drive-through clinic. And as of 3 p.m. today, the Heartland Health Service drive-through clinic on East Bluff did another 150 tests. Tomorrow, the Heartland Health Service clinic will be open here at the Peoria City County Health Department at 10 a.m. Again, the site located at the health department will be available only on the weekends. And next week, the third site will become operational. I know there's a lot of questions. I think the focus even on the governor's discussion today was why the importance of testing and increased testing as we continue this approach to relax restrictions. And just to give some perspective, these numbers are not set in stone because, again, when reporting was happening and how reporting was done. But in the Tri-County between March 16th and April 17th, we reported close to 8,000 tests completed in a 33-day period. To give perspective, in the past 4 days, Heartland Health Services was able to do 600 tests. That would have been about 7% of tests done in the prior 33 days of that time period. Right now, our testing data gives us about a 14% positivity rate here in Peoria County. So again, just to give perspective on, while the numbers might seem low, think of it in this sense that 1 out of 10 individuals, actually more than that we've tested so far, have come back positive. So with the stay-at-home order, a lot of this is focused on the fact that we want to make sure we are protecting some of our most vulnerable population, and that includes individuals that are elderly. And with that, I'd like to introduce Lori C. from Central Illinois Agency on Aging to discuss further.
Thank you, Monica. My name is Lori C., and I represent the Central Illinois Agency on Aging as Director of Information Resources and Community Support Services. Our service area covers the 6 counties of Stark, Marshall, Peoria, Tazewell, Fulton, and Woodford. Currently, under the COVID-19 recommendations, though some staff are working from home, our agency remains fully functional and able to address the needs of the elderly and persons with disabilities within our service areas. We have a phenomenal team that is ensuring that everyone is being taken care of and their needs are addressed and met via phone, internet, and service referrals. One of the most important services the Central Illinois Agency on Aging provides to seniors over 60 and persons with disabilities over age 18 is that of nutrition. Currently, staff and volunteers are providing 1,150 hot home-delivered meals Monday through Friday, and frozen meals are provided upon request to cover weekend needs. The meals are prepared by OSF and the Neighborhood House and delivered by drivers through the Neighborhood House and Central Illinois Agency on Aging. There has also been about 4,000 more shelf-stable meals ordered for nutritional needs that are being distributed throughout the 6 county service areas. In addition to the nutrition program, we are still offering caregiver assistance, including respite services, Alzheimer's and dementia-related programs, and grandparent raising grandchildren programs. Our transportation services are limited to doctor's appointments and grocery shopping only, and we are utilizing sanitary practices and taking client temperatures prior to transporting. The transportation department is happy to accept donations for the transportation services. Our benefits access team is still processing reduced rate license plate, stickers, and free bus passes, as well as addressing Medicare and Medicaid inquiries. As you can see, the Central Illinois Agency on Aging is fully operational and happy to provide these services. Finally, I would also like to mention that we are advocating that everyone complete the 2020 census. It is short, it's only 9 questions, and it does not ask for any financial or citizenship information. As you know, the census is important because it helps to acquire and distribute funding within our communities to support local programs. For further assistance or to be provided with services, please contact the Central Illinois Agency on Aging at 309-674-2071. Could you repeat that one more time? Of course. The phone number?
Yes, please.
309-674-2071. And you can also follow us on Facebook. Thank you.
Thank you, Lori. Next, we have Dr. Ted Bender from UnityPlace to discuss senior mental health issues.
Good afternoon. Thank you to Lori and the Central Illinois Agency on Aging for all the great work that you're doing. It's really appreciated. Before I get started on senior mental health, there's a couple housekeeping items I wanted to go over. We've been hearing stories at the hospital and across the country of people not going to the hospital because of fear of infection when they're having medical emergencies. Just recently I read a couple stories about someone who had a burst appendix, other people having heart attacks in their home because they're too scared to go to the hospital. I can't stress enough the importance of continuing to use the ER as you would if we were not in the middle of this pandemic. If you are experiencing emergency symptoms, or emergency health situation, it's critical that you go to the ER just like you would if we were not under the coronavirus pandemic. So I want to assure you that our emergency rooms at UnityPoint are safe. We're taking all precautions necessary, and we are open to help you with any of your health concerns. Another item I wanted to mention was we are putting out a plea for cloth masks. Again, we do have a continued need for cloth masks. We have partnered with OSF Healthcare, Heartland Health, University of Illinois College of Medicine, Peoria, East Peoria Fire Departments, and Pekin Police. So if you are a seamstress or a crafter or you know of one, we could really use the public's health in this effort. We have posted mask patterns for what is called the Deaconess mask on our website UnityPoint.org. And you can drop off homemade masks at many different locations, including the Hult Center for Healthy Living, the Peoria Fire Department, the East Peoria Fire Department, the Pekin Police Department, the Heartland Health Services on University, and University of Illinois College of Medicine. Thank you all for that. So I'm here today to talk about senior mental health and mental health during this pandemic in our senior population. We know that increased isolation is concerning on all of our mental health, not just our seniors. But for our seniors, it can be particularly difficult. There's mounting evidence to suggest that this pandemic is disproportionately affecting older adults. Although that data is early on, there is evidence to suggest that they are taking this especially hard. We know from past research, years and decades of research on loneliness, that loneliness increases risk for anxiety, depression, and heightened stress. Loneliness has been shown very clearly to be as dangerous as smoking 15 cigarettes a day or having an alcohol use disorder. It has a significant impact on our mental health. So it's often useful to try to find information from our history on impacts during times like these. Although this feels very unique to most of us, there have been other outbreaks that we can draw information from, like SARS in the early 2000s, 2003. During 2003 and the SARS outbreak, there was a lot of research done, and we did learn that social disengagement, mental stress, and anxiety led to significant increases in self-harm behavior in some older adults, especially in the over 65 population. Now that can be scary for many people, but it also tells us that if we can anticipate these problems, then we can create targeted interventions to help reduce or prevent these issues. We must learn from the past. We know that in America, over 14 million older adults live alone. Getting caught in the coronavirus pandemic, living by yourself and being stuck in your home indefinitely is very, very difficult for people to endure. There are some things that we can do to help our older adults, to help our aging population. There are some tips, and I've been talking about these tips very regularly, and many of these apply. The first thing I'll say, and I can say from my own personal experience, one of the most important things that I've really adopted is getting a little bit more sleep when possible. To be completely honest, in my own personal life, I'm pretty much going to bed when I put my kids to bed these days. So around 8:30, that seems pretty early. But I've been getting about an extra hour of sleep, and it's really helped me continue on and to develop that mental toughness that we all need to really work on right now. So this is no different for older adults as well. Really putting effort into regular sleep patterns is going to be crucial to getting through this. Also, daily connectedness. If you're incredibly isolated during this, it's going to be very, very vital for you to seek out connectedness, whether that's through family or friends, through telephone or Skype or video conferencing, however you're used to communicating. It's also a pretty good time to pick up some new hobbies. There is a lot of online learning out there. I did some poking around on this recently just to see what was available, and I learned recently that many institutions are offering free online college courses. Even some Ivy League schools are offering free classes online right now, so what a great opportunity to learn something new for free. I've been asked about spirituality for those who are very spiritual or are missing their kind of that spiritual connectedness. There are televised online services. There are online support groups that you can connect into for your spiritual needs. Exercise, again, I can't stress enough the importance of self-care during this pandemic. Age-appropriate exercise with doctor's consultation, of course, is highly recommended. Again, for our seniors, medication management is crucial, making sure that you continue to take your medications as prescribed, making sure that you have enough supply, and also making sure that you have your medications. And again, if you're struggling with this, there are resources that are out there to help. Also utilizing friends and family to help you with that, to make sure that you have the medications you need. And finally, structured time, I think, is really important as well. Structuring your day, make it business-like if you have to. But I also want to end by saying that there's just going to be some days during this time where it's okay to sit around and just do nothing and rest and take care of yourself. We're all struggling with this. We're all in this together. And we are going to need to develop and continue to develop a sense of mental toughness going forward, because we just don't know when this is going to end. UnityPlace is here to help for all mental health, behavioral health, substance use disorder needs. We remain open for business. We continue to serve the public in an almost complete 100% capacity as we were before this virus. Our UnityPoint Access Center is open and taking calls 24/7. That number is 1-888-311-0321. Again, 1-888-311-0321. If you're struggling, if you have a sense of increased depression, anxiety, or thoughts of harming yourself, please reach out to us so we can help. Thank you.
Thank you, Dr. Bender. For individuals that have questions for either Lori or Dr. Bender, the public information officers have their contact information available for you to ask questions directly. I know there's a lot of interest and understanding about what this extension means, as well as kind of the follow-up with that. And so our next speakers are Sheriff Brian Asbell and Chief Loren Marion to discuss how the stay-at-home extension means.
I brought a copy of the order. Thank you, Monica. Good afternoon, everybody. Yes, in relation to the governor's extension and the modification of this executive order, we've already fielded quite a few questions in relation to the interpretation of this. What is allowed, what is not allowed, what type of businesses, even more explanation on the boating regulation. So we've started to ask these questions to the pertinent agencies, but a lot of these questions centered around how we're going to enforce this, no different than we've had these conversations in the past. And I'm speaking, and Chief Marion will be right behind me, but our message remains consistent that our first goal is education, followed by enforcement, and that's to continue to be the case as we move forward. Every situation is unique, and we look at the totality of the circumstances, and that's how we do the enforcement. There's different levels, so I just can't sit here and say A plus B equals C. We're learning as we go. We do have questions. I have a question specifically with the boating regulations that's been addressed to the IDNR, and we're just waiting for their response, because if I have a family of 4 and I'm in the car together, does it make sense? So, and we expect to get some clarification on this, because I think some of these will have more before the May 1st dates, and we'll release those as soon as we get those. The same thing with golf. We're waiting for the DCEO office to give us more of an interpretation and what the rules are for this. But as for businesses, that is going to be one of the big questions, how this is managed, whether if you're continuing as an essential business on the inside. I thought that one was pretty explanatory, what employers require to do. The other one's going to be how we're going to regulate the mask or face covering. I think that's the best way to put this, because we continue to say mask, but it doesn't have to be a mask. That is what we're trying to have these conversations with our area employers. They have the right. The employers have the right. It's no different than we've had forever. No shoes, no shirts, no service. So they can stop individuals from entering the store. However, if law enforcement will get involved at the point there is, this escalates to a law enforcement situation. So we're both here to answer questions. Chief, if you want to say a few things, and then I'll step over here.
Good afternoon, everyone. I think the sheriff summed it up very well, and we're on the same page on this topic. And it goes back to education, compliance, and enforcement. So we need to make sure that everyone's getting educated. We are requesting compliance. That's what we stress to the officers, or I stress to my officers all the time, is if you have these calls, ask for compliance, and then if it rises to a level, then it may come to an enforcement. I would like to touch on something real quick. I know last time that I was here, we discussed an incident that happened April 1st up at Aldi's, and this is a good example because when you talk about when enforcement comes into play, we had an individual that was at Aldi's on University and that was coughing on someone intentionally and acting like he had the COVID virus, and our officers responded, did what they were supposed to at the time. I followed up with the state's attorney's office, and they had agreed to up the charges to an aggravated battery. Last night, that individual was located and arrested for aggravated battery in regards to that case. So we are taking this very serious and will not tolerate those type of incidents. So open it up to questions for us.
Both of you, but I guess first I'll direct it to the sheriff. So when you are responding to, for example, businesses that, don't fit this new kind of guidelines that have come out, and when you say, education and then enforcement, what are the conversations? What's the dialogue, and then then what constitutes necessarily like a write-up or a charge?
Fortunately, everyone, not everyone, but we've had mostly compliance on this, and even the business owners are calling and asking the questions, and if we don't have the answer, we're referring them or we're making the call ourselves to the Department of Commerce to try to get clarifications. And this morning I had several questions, photography businesses and things like that, and just reading what the modifications on the order is. No, you wouldn't be allowed to run a photography business inside, but you can do it outside. You're more than free to do that now, and so each of these on a case-by-case basis, and we have to. I have to make the call sometimes because I don't know. We've been put in often a lose-lose situation. Law enforcement, I've said this before, we've been asked to do things we've never been required to do before, and nor do we like doing a lot of these. But again, our role here is no different than what public health role is. It's to save lives and have a safe community. That is what our duties are. And all these has different pieces to this. So churches, for an example, I had a talk with the pastor this morning. We've had this conversation before, whether or not the parking lot services. Now with the relaxation of the order, I've read through this, and I believe there could be a parking lot as long as safe distance and the windows will roll up and PPE is used. However, in my same breath, I'm going to say to the pastors, you have a responsibility here too. We all have a responsibility right now to create these safe environments. There's a lot of potential risk involved. The unknown factors. What if the windows are down, someone's sneezing, someone's coughing? So again, with these situations, we want people to start, enjoying their lives and trying to get back to normal at the limits they can. But we still have to have, some instructions to kind of focus how to move forward.
So, when you talk about these complications of you guys not necessarily always knowing the answer to, talk about how that puts kind of, your people in sometimes a difficult situation if you guys may not have the answer. And business owners may say, well, then I'm going to continue to do this. And in addition to that, it'd be the lack of consistency too. Different jurisdictions have different interpretation of how this should be managed. We have an issue in the state right now, not an issue, but the constitutional sheriffs that say, no, I'm not going to abide by any of these provisions. And don't get me wrong, I support and defend the Constitution of the state and the nation. Chief and I both joined the Army right after high school. We've been in this business forever. However, we also have a duty to protect lives and liberty. And there's a relationship between the two right now. Certain liberties can affect someone's life. And it's trying to find these balances. So again, the moral of the story is
all these complaints will be on a case-by-case basis. We're going to look at the totality of the circumstances and make a reasonable decision how to manage it.
With all the negative reactions to the extension to the stay-at-home order, I know you guys said you haven't had an issue with compliance yet, but going forward as more feelings emerge from this, do you worry about compliance in the next month?
Yeah, I do. And I'll start. I mean, we're monitoring social media activity. I mean, there's a sense sometimes of civil unrest, and again, we're just going to be consistent in our messages and say, please, for us to eventually get out of this, we all have to work together as a community. And that's just not Peoria County, it's the whole area. It's working collectively to get us to the next step. I think the more we resist, the longer we'll probably be in a status. So that'd be my message. Chief?
Could you repeat that real quick?
Yeah, there were a lot of negative reactions when the governor announced another 30 days of staying at home. You guys haven't had much issues with compliance lately, but is that a concern going forward as more people start to get agitated?
Right, and one of the things that we've seen, we've been very fortunate that with the weather's been in our favor as far as law enforcement. Once we see a break in the weather, I think that's going to draw more people outside as well. We've responded to over 200 calls, almost 250 calls of people calling in saying that people are violating the social distancing order. So I see that going up and increasing. Up to this point, we haven't had an issue with it. Everyone's been compliant. And to go back to a previous question, I think as far as the city's concerned, we have a good process in place on how to address the businesses that are considered essential or non-essential. We have several different departments within the city involved. We have our community development, our economic development, our legal team, and the police department. That all, so if an officer responds to a call, they'll document it in a report, and it gets forwarded. If we know for sure it's a non-essential business, it'll get forwarded to the state's attorney's office, and that's kind of the enforcement piece of it. Calls that come in, and we have a process where the economic development department will call that business and explain to them that they're deemed non-essential, and then we will follow up and check on it. So I think the process that we have is working, and I think that's one of the things, going back to the education piece, and as to why we are getting the compliance that we are. So, but I do think that once the weather breaks, that it will get busier for us.
Has this changed, this is for both of you, your staffing at all in terms of, like you said, 250 calls, about just social distancing. Has this changed staffing in terms of the number of people you want on certain shifts where more of those calls could be coming in?
Yeah, so as far as the Peoria Police Department goes, for example, our patrol division, we basically divided patrol in half, and they were working 7 on, 7 off, and on the 7 off, 3 of those days were on standby to where if we needed additional staff. That really reduced the number of officers that were on the street. Now that we're getting, it's getting warmer, it's going to get busier, we're going to have to look at different adjustments to make in staffing.
And compounded by the obvious budget situations we're all facing right now. So every nickel, dime, quarter is being watched. So we're really trying to limit the amount of overtime. So we're doing more with less. We have been for the last couple of years, but this has exaggerated to another level. So you look at certain shifts and you look for patterns and you try to determine what your volume will be for having enough resources to get through the shift. But dollars are part of this conversation too, and it's something we're being conscious just to get through this year's budget, and we know it's going to affect future budgets. Thank you.
Are there any questions for me?
Go ahead.
So you're looking at the results, or in terms of the testing site, is this all from the second day of testing, combined first and second day of testing?
I believe this is actually a little bit of a mix for the 3 additional cases that were coming from the Heartland Health Services. And we're working with the lab. I think that's kind of a key thing the governor even discussed, is that we really are getting more labs online. It's really, the first focus was to get labs online to do testing. And now we're really recognizing that we need to also support them so that they're able to report things quickly, as well as have that type of data analysis available. And so in this case, I think the additional the 3 cases that were reported today, one of them might have also come from the afternoon of the previous day.
We've seen a couple questions with testing, and I'll kind of describe the situation to ask this question. But does somebody get tested first? Because we've had questions about if somebody gets tested multiple times and it's positive, is that 2 counts towards the total, or is that still just 1 case?
So the question is, if someone gets tested multiple times and they were initially positive, does it add to the count? And no, because the way the reporting, every positive case is assigned a specific state number. Think of it as your own personal number. And so even if there's an additional test, it gets mapped back to your original number. And so we're just going by those ID numbers.
And with the elective surgeries now next month, do you know what kind of surgeries are going to be considered electives next month?
So the question is, they are expanding services, especially healthcare services. We tend to not want to use the term elective because I think people think of elective as meaning just random, but they're still very important surgeries to have. And the healthcare providers, we're actually on a call today with both hospital systems. They are making sure they're prioritizing and understand those needs. We're hoping that Illinois Department of Public Health releases a little bit more guidelines next week onto what that qualifications are, and whether or not there's going to be additional requirements, such as do we require people to test prior to surgery so we understand what other controls that needs to be happen. Well, thank you guys, and we'll see you guys on Monday.